So I just spoke to Dr. Keller, and he sends his best, and he's going to try to come over at some point over the next few days. So the pathology report came back, and it's an interesting situation. The cancer is called a carcinoid tumor, and that might not mean much to you. The carcinoid tumors are a little bit a little bit more rare than some of the other types of cancers that can cause this type of problem. We need to get a medical oncologist to speak to you about the risks and the benefits of chemotherapy. With carcinoid tumor, there are a couple of medications that are actually pretty effective, and they do a pretty good job. And the side effects are manageable and not like when you have leukemia and you get just knocked down badly by the chemo. This is a more gentle situation. So I would definitely want you to meet, and I'm going to call Dr. Cohen, Alan Cohen, and he's at Rocky Mountain Cancer Center, and he is an expert at these kind of cancers. And I've had several patients that he and I have worked together on, and so I'm a little bit surprised by the report, and maybe in some ways your options are perhaps a little bit better because these types of cancers can be responsive to the chemotherapy. So there's a lot of issues that need to be decided upon. Everything would be for your decision. Nothing would be done without you saying that I agree and want to go in this direction. Mm-hmm. But there are some cancers where the situation is really more of a hopeless situation, and this cancer is not one of those types. And so I think that you've got a hard battle in front of you, but there may be some favorable issues with the type of cancer that you have. Mm-hmm. Okay. Now and again, it's there's a lot of specialized knowledge that you don't have about this, but I think you'll like Dr. Cohen. He's a very nice man and very knowledgeable, and has a particular expertise in this kind of cancer. So I think that's good news for us. Okay. Mm-hmm. I'm going to speak to Dr. Cohen, and I don't know what his schedule is. Also, we wouldn't be starting any chemotherapy anytime soon. You need time to recover from surgery. So there's no decisions that need to be made immediately. And sometimes Dr. Cohen goes up to Steamboat and has a clinic up there, and he does a bit of speaking and traveling. So if we can't get him to see you while you're here in the hospital, that's okay, because we wouldn't be starting anything anyways. Okay. In which case we would just provide you with the means to set up an appointment to see him in the next coming weeks. Okay? Do you have any questions?
I do.
Yeah.
Did you say that this was a chemical treatment?
It's called chemotherapy. Chemotherapy, not a chemical, but it's chemotherapy. It's medicine that one takes.
It's a medicine. Got it.
Yeah,
okay.
You know chemotherapy,
yes,
right? I mean, it's
okay.
It's the medicine that is used to treat cancer.
Okay, but this is not as powerful as some of the other chemo?
Depending on what type of cancer it is, there are different chemotherapy medications.
Okay, I got it.
There's probably maybe 200 different medications.
Oh, okay.
And some of these medications have very tough side effects.
Right.
The medications that we use for carcinoid, in general, are a little bit more gentle.
Mm-hmm.
And so I'm just sharing that with you, with the idea that again, there may be some favorable aspects to considering doing some treatments.
How invasive is this cancer, as far as you can tell from the CAT scans and from your surgery?
It's very invasive.
Okay.
It is spread into the liver.
Okay.
It's spread throughout the belly.
Okay.
I don't know if it's anywhere else. Part of our workup would be to do some tests to see if it has spread to the lungs, to the bones, things like that.
I see. Okay.
So that information would be the kind of thing that Dr. Cohen would be in charge of ordering.
Okay.
So that's, so it's a stage 4 cancer. The issue is you know, are there some possible treatments that would prolong life and increase the quality of life?
Okay. All right.
You know, so.
And when you contact Dr. Cohen, is he going to automatically contact us, or what do we need to do?
I have no idea.
Okay, what do we need to do?
Yeah, no idea.
Do we need to go through Dr. Keller?
So I've spoke to Dr. Keller, and Dr. Keller has put through the authorization for Dr. Cohen.
Oh, okay.
And Dr. Keller agrees that Dr. Cohen is an excellent choice for this situation. So the logistics, I don't have any information.
Okay.
Yeah.
Okay. Right.
Yeah.
That's good. Okay.
All right.
Well, sounds to me like you're in good hands, dear.
It does.
Yeah. Yeah.
Yeah. So you know, a lot to absorb. You know, 3 days ago you didn't know that you had cancer, and you were, you know, living your life, and now, you know, here we are. I'm hoping that you feel better enough to be able to eat more freely, and that your belly pain. And again, I think that the medical treatment that Dr. Cohen will speak to you about, that may also help with issues of any belly pain that you may be having.
Can we start this medicine and then see it's not working? Can we change to something else?
Absolutely, and Dr. Cohen would be in charge of that, and so that would be the kind of discussion that you'd be having with him, you know, throughout your care. We always are assessing to make sure that the treatment is working, is effective.
Yeah.
Yeah. So I've got 11 o'clock.
What is the name of that cancer again?
Carcinoid. CARCINOID.
Okay.
Carcinoid. And
Okay.
Dr. Al Cohen, COHN. Alan, COHN, and he's with Rocky Mountain Cancer Center.
Alan?
Yeah. All right. Okay, now, this weekend, my partner, I think it's Dr. Medina, I haven't looked at the schedule yet, but it's the Labor Day weekend, and I'm going to be leaving at the end of today. I'll be back on Tuesday. I suspect you may be ready to go home before Tuesday. Now, the question is going to be, are you safe to go home with support, or do we need to send you to a short-term physical therapy type of situation if you need to regain more strength, to regain your independence? This is a situation where you're not going to be losing your ability to go back home and be independent. The question is whether, when we're finished with the hospitalization, whether you're strong enough and it's appropriate for you to go home. So I would hope that the case manager would have stopped by and would be speaking with you about any your capabilities at home, what kind of support she might need and what kind of support she'll be able to get, and whether or not we need to be applying to some of these short-term rehab type facilities where she could get her strength further prior to going home. So.
Well, when will we talk to the caseworker then? You don't know.
And again, the logistics, I don't know. It's got to happen today because of the weekend coming up.
Sure.
And if she hasn't stopped by yet, then I'll ask her to stop by today.
Okay.
But again, we're just talking right here now.
Okay.
So if on Tuesday you're still here, I will see you. However, you may be eating and pooping, and your wounds look good, and your labs and everything looks good. So that, you know, in the next 3 days, you may be safe to go and leave the hospital. Okay? Okay.
So it sounds like the surgery was successful.
It was.
Good.
Yeah.
Steps that I have to take to get to my house.
Has physical therapy been working with you while you're here?
Yes.
Okay. And so, you know, they are a big part of the assessment as to whether you are safe given the challenges of, you know, your physical home.
Well, we can overcome that because my former wife had strokes and she could no longer go upstairs, so we converted the living room into a bedroom. And we have a bathroom on the main floor. So, and then my mother came to live with me, and we did the same arrangement. So we can do the same thing.
So that's the kind of discussion with the case manager to figure out what kind of resources you have available, and you know, you may be able to go home because of this kind of situation you have. Okay.
Well, thank you for stopping in, and thank you for your.
My pleasure.
Thank you, Dr.
My pleasure.
Appreciate you.
Appreciate it. Okay.
You're awesome.
Thank you.
All right.
Thank you.
Okay. Bye bye.
So, Mama, I have recorded this, and I'm going to share it with Emmett and the family so that they know what's going on. Is that okay?
Yeah, with them especially.
Yeah.
He's,
So.
Oh, you recorded all that, huh?